The World Health Organization's delayed approval of the Russian-made Sputnik vaccine is among several reasons why the Guyana Public Service Union believes that the health of the Guyanese populace should not be compromised with the continued use of the shots. During a press conference at the union's headquarters at border Georgetown on Thursday, President of the union, Patrick Yard, drew attention to a recent article published by Reuters, which outlines concerns highlighted by the World Health Organization with the filling of vials at a Sputnik vaccination plant. The article further indicated that the concerns did not relate to the safety and efficacy of the vaccine itself. However, the vaccine is still undergoing review by the World Health Organization. Yard said that even though in the initial stages of Guyana's vaccination campaign, approval by the World Health Organization of the vaccines might have been taken for granted, emerging data about the shots should be used to guide public health decisions locally.
Guyana is not a frontline country. We don't have no labs or anything to determine the different strains and all these things. We are operating on information from the developed country. We don't produce a single vaccine here. We don't have tests being run to determine what is happening or what's not happening. We must recognize our limitations, and we must be careful in how we get about what we're doing.
Education officer of the union, Vera Norton, made mention of a number of worrying factors that came out of a report conducted at one of the Sputnik vaccination sites.
At the site, the WHO's pre-qualification inspection team found issues with the integrity of data and tests results produced during quality controls of the shot. The report also identified concerns with the implementation of adequate measures to mitigate the risks of cross-contamination, it said, and with sterility, including with the clothing worn by those operating the lines.
Yard is reminding that the vaccines alone are insufficient to protect persons from COVID-19.
There are the measures that must be instituted. Wearing the mask, social distancing, washing your hands, and a variety of factors. We have requested meetings, and we are offended that these meetings have not come about as yet, where we wish to discuss even the rearrangement of offices.
Similar calls for a halt in the use of the Sputnik vaccine have also been made by opposition leader Joseph Harmon. The government has maintained that it will continue administering the jabs since its main aim is to keep its citizens safe to reduce the rising death and infection COVID-19 rate. Like many other countries, both in the Caribbean and further afield, which have been vaccinating its populace with the Russian-made Sputnik, the Guyana government is adamant that the benefits of accessing vaccination far outweigh any minor risk. Apart from the Johnson & Johnson, AstraZeneca, Pfizer, and Sinopharm vaccines, the World Health Organization has not approved any other. Guyana is offering the AstraZeneca and Sinopharm vaccines to citizens. From the list of vaccines currently being used to inoculate Guyanese, only the Sputnik vaccine has not received approval from the World Health Organization. Temika Rodney reporting for the HGP Nightly News.